As you know, I have support hose on right now.
Are they staying up today?
Not really. Dr. Lori gave me new ones yesterday. It's a little unsettling, me walking around pulling up my support hose. I recently paid a visit to Dr. Lori Greenwald's offices in Bloomfield to learn all about varicose veins, which my mom suffers from, and my mom suffers wicked bad
they can be very painful varicose veins.
Very painful. And I have spider veins on my legs, and I heard about a fairly new procedure that gets rid of both. It's all outpatient with very little pain. This you have to believe to see. Take a look.
It's an exciting day for Patty Finnevolden. Nope, she's not picking up a new car, nor is she leaving for vacation. She's visiting Dr. Lori Greenwald's office in Bloomfield.
Hi, Patricia. How are you doing today?
Fine, thank you.
Now, you just had the ultrasound on your right leg after the procedure.
A procedure that changed Patty's life for the better. Varicose veins were running up and down her legs.
You know, we're looking at right now at before pictures of your legs, Pat.
Okay.
Not good.
No.
Tell me what that was like and how long it was like that for.
I had probably the last 10 years, like bad. Like even if I had slacks on, my veins would show through my slacks.
You gotta be kidding.
No. So I had a cluster of them right here and all the way down here on my leg.
In terms of a 1 to 10, where's Patty in severity of varicose veins?
Well, she was about an 8.
Seriously, that high?
Yeah. The veins were huge, distended. There was some color discoloration where the veins were protruding. You see right here is functioning of a normal vein where the valve opens, blood flows to the heart, the valve snaps shut, and the blood stays.
Okay.
So we don't get any blood pooling in the legs. So now when somebody has the varicose veins, we have a damaged valve, and as you can see, the blood is going backward.
Patty no longer has to worry about her varicose veins. Thanks to Dr. Lori Greenwald, they're gone. Dr. Greenwald uses a fairly new procedure called the closure procedure, or radiofrequency ablation.
The closure technique, which is the one that I do, started in Europe in 1998, was FDA approved in 1999, but didn't really pick up until 2004, 2005.
According to Dr. Greenwald, a catheter is passed through the diseased vein. It heats the wall of the vein up using this radio frequency energy. The vein collapses, gets sealed off, and eliminates the varicose vein. That was back in December. Pat's legs look and feel incredibly better, but she still sees a lot of discoloration from what's known as spider veins. And that's what today's procedure will remove.
So now we have to focus on making your legs look better.
Dr. Greenwald shows us how it's going to look.
This is a limited area of spider veins.
Okay.
We then treat first round.
Okay.
So you have about a 50% clearance.
Okay.
You then come back, usually 6 to 8 weeks in between treatments if you're treating the same area.
Okay.
Now we have another 50% clearance.
Okay.
And for this patient, after her third treatment, she's clear.
Now it's Patricia's turn.
Are you excited about that?
I'm really excited. I used to get nervous if I would go to the dentist.
Yeah, me too.
And I didn't get nervous here. I mean, truly.
Yeah.
I mean, you hear people say that and you think, yeah, really?
No, it's true.
And Dr. Greenwald's confidence and she's like, you know, you just know she can do it for you.
Right.
Yeah.
Dr. Greenwald gets prepped, asks Patricia to lie down, and gets down to work.
What I'm going to do now is all you have to do is lay still. I'm going to just clean your leg up with a little bit of alcohol, and you'll get a series of little pinches.
The injections begin. What's going into Pat's spider veins?
This material is called sodium tetradecol. The material is going in the vein, and you'll see that the entire system is being flushed out, so there's no blood in it at all.
Amazing. Just like that.
See, it's all gone.
Now, Pat will need to come back 2 or 3 more times for further treatments, but she's well on her way to having a great pair of good-feeling, good-looking legs.
When you see, I know it's tough to watch a needle, but you don't even feel a needle, by the way. It's just like a little tiny prick. When you actually see, I know I had it done, you watch your veins disappearing.
Yeah, it was pretty magical.
It's unbelievable. I think it's a miracle. I'm like, oh my God, you're like watching it, and you're not under any anesthesia.
And then afterwards, you just wear support hose for 2 weeks.
2 weeks.
Make
and
sure
then,
that they don't come back.
Right. No sun for 6 weeks. You have to make sure that you do what Dr. Greenwald tells you to do, because if not, the veins could fill back back in. So you have to wear the sport hose. But this woman, not only is that, she's hysterical and a personality. Guess where she's from?
Long Island.
Long Island.
We'll be right back, and Monday we'll see your veins go away.
Monday we're going to watch my veins. Stay with us. All right, now, on Friday, did you see the story on Friday?
Yes, I was here. We watched the vanishing varicose veins.
Vanishing varicose veins and spider veins. We watched a patient have her unsightly spider veins removed, and it was amazing. She had the varicose veins done before the spider veins. Well, since I have those same spider veins, I decided to go and have Dr. Lori Greenwald take a look at mine. The results are amazing. You're going to see some video here. It's little needles on skin.
I don't like the needles.
I know. We have to show it to you, though, because it really shows what's happening. You're going to see, it's like magic. The veins disappear.
It didn't hurt?
It didn't hurt. Take a look.
Dr. Lori Greenwald watches me on TV. She knows I'm a bit of a character at times. That's why when I told her I had what I thought to be spider veins on my legs, I'm not sure she believed me. And then she saw them.
Oh, you do have veiny legs.
Oh, yeah.
Great.
Yeah, I got them.
Okay, so we definitely will be able to help you.
Good.
And it's also good to know that the woman who will be working on my legs comes with a lot of experience.
How long have you been in business? Been in this field?
Well, as a vascular surgeon, 25 years.
And she started when she was 6.
And I love you even more. And then 5 years ago, in 2003, I decided that I wanted to focus my practice specifically on vein disorder. It was at the time where all these new interventions were coming for vein disease. And up until that point, you didn't have much to offer people. People didn't want to have their veins treated, and they suffered for years and years.
But today, treating varicose veins and spider veins, which is what I've got, can be treated so easily and quickly.
Around 2000, they started coming out with minimally invasive techniques that were very, very short, minimal pain, office-based procedures, and the time was ready. And we could offer so much to people.
Hence the reason I'm here today. I've stood on my feet forever. Working in that supermarket for 10 years certainly didn't help matters.
There's no seats in a supermarket.
And over the years, I've noticed these tiny and not so tiny veins popping up. The first thing we do is chat. Dr. Greenwald wants to know everything about me to make sure she knows what she's dealing with. And so the questions begin.
I noticed here that you weight lift, you do cardio and weights.
Yeah.
Okay. How heavy are the weights that you lift? Now, if I were to put you out on the street and tell you to walk at a good pace, how far do you think you could walk? Any problems with fear of needles?
I don't like them.
How old were you when you noticed the veins in your legs?
40? Late 30s? Early 40s? I was like, what is that? Like, I looked in the mirror, I thought it was a bruise. And I said, oh, that'll go away. And then I looked, it didn't go away. And then I looked closer, and I'm like, that's a vein.
You think they're getting worse?
Definitely. I mean, this one's been there the whole time. And then now this one's starting to trickle down my leg.
I will definitely be able to help you.
The shoes and socks come off, and Dr. Greenwald starts the examination.
All right, so you can go ahead and lie down for me.
My pulse is checked, and then it's onto my legs and my feet. Then Dr. Greenwald asked me to stand up, just to make sure there are no patterns of varicose veins at all. I have none, but
he does have some spider veins here and here.
Other leg?
And you pretty much have the same thing, here and here.
Back on the table for a closer look.
See that blue vein? This whole chain is connected.
Begone, ugly veins, begone. A few photos are taken before the work begins, and then Dr. Greenwald gets the needles and starts injecting the veins.
We use a solution called sodium tetradecol. It is the only compound that's FDA approved.
And that's what makes the color disappear.
Yes, and it works by basically breaking down the proteins in the vein wall, and then the blood goes away, and the walls don't really work anymore because the proteins are gone, and they stick together.
And now, is that bad that the veins aren't going to work anymore these days?
No, because those veins
are damaged.
They're damaged. They serve no purpose at all.
Did you see that? Watch it again. Is that cool or what? With each injection, the veins are disappearing. The only thing I feel is the little prick of the needle. It's really amazing.
That's it?
That's it. Now my legs will be insured by Lloyd's of London, and I'll be able to go onto the beach this summer.
Dr. Greenwald applies cotton for compression, and it's time for my hose. Jackie helps me with these, thank goodness. The hose are very important. They must be worn for 10 days to prevent the veins from filling back up. And who wants that? Not me.
Poor Jackie, she's scarred for life. But
Now you know what women feel like when we're putting on Spanx and trying to wear dresses.
It's absolutely ridiculous. I'm like, and I got them on right now. You got to wear them for 2 weeks. Now, there are certain things that we have to... Dr. Greenwald asked for 4 things. First is you got to do what she tells you to do. Be patient. It's a slow process, depending on how bad your veins are. Now, I see a little bit of coloration, so I'm going to have to go back for another procedure. The veins will also look worse before they start to get better.
Okay.
And last but not least, no sun in that area, wherever you've had the work done for at least 6 weeks. So you got to make your plans. A lot of people come in, they like to get their appointments over the summer, they like to get evaluated, and then they start it in the fall.
Yeah.
Because they're not going to be spending a whole lot of time in the sun during the fall.
And that's not usually covered by insurance, but...
Spider veins are not, but if you have varicose veins, they most certainly can be. And spider veins might be an indication that something else is wrong, so she always recommends coming in for an evaluation just to see if there's anything else wrong, and they might be covered under something else. But check her out. She's absolutely amazing. She's in Bloomfield. Dr. Laura Greenwald, thank you so much.
And we'll get to see you model your support hose tonight.
Yes, we'll be right back. I'm going to be wearing hose and shorts tonight. Veins on my legs.
Which we have to back up if they didn't see it. A lot of people think men don't get these, but
No.
I saw them. You had them.
While I was in the waiting room to get this procedure done, there was another gentleman there, and I was like, what are you in here for? Because he has horrible varicose veins. He was a corrections officer, and he's on his feet all the time. And this can really be debilitating. Now, mine were more cosmetic than anything else. So I headed to Vanishing Veins in Bloomfield, where Dr. Laurie Greenwald was there, and she took care of me. And we went back weeks later, after I did everything that I was supposed to.
Including wearing your support hose.
My support hose, for a little checkup. Let's see how it went.
You had a big varicose vein over here.
We're back at Vanishing Veins in Bloomfield to see if my once purple and green veins are now considered vanished.
Have you had any problems at all?
No. I did exactly what I was told. The stockings for 72 hours, I wore them into bed, I wore them every night. After 72 hours, then I wore them from sun up to sundown. I didn't work out, I didn't go into the sun, and that's what I did.
Okay, any discomfort, any bruising? Or
No,
any...
I told you the only and I'll get you for this. I had to pull that tape off, and with the hair, it was bad, but it was actually funny. My neighbors heard your name. Dr. Laurie Greenwald!
Dr. Laurie Greenwald had me lie down to check the progress. I had one official varicose vein that she treated, as well as a number of spider veins.
Now, for the first couple of weeks, I was looking at it, and the color was there, and I said, oh, this thing didn't work. And then I looked down, and week after week after week, it got lighter and lighter and lighter. Now I'm looking at my leg, I can't see anything.
Right. So this is the key, because if you look at your picture, this was before.
Okay.
Remember, this was the only varicose vein you had.
Okay.
And it was about 4 or 5 millimeters, and it was pretty dark blue.
Right.
The reason I didn't see immediate results is because after the treatment, the veins go through a chemical reaction. Dr. Greenwald says it can take weeks to months and could potentially need a second or third treatment. In my case, the first time was a charm.
When you were first here, I showed you the diagram.
Notice the colorful patches of veins.
But if you notice, with each treatment, the area gets lighter and lighter until it's finally gone. So you can never predict how many treatments a particular area is going to need.
It just depends on the person. And of course, following the post-op directions helps too.
So my case, they were not
bad.
Not bad.
Not
and
bad.
now they're not there.
And now they're not there.
Neither are the other spider veins she injected along my calves and thighs.
You have just the tiniest bit left here, but it's still fading. So you could see the blue lines.
Yep.
And then you see it's just fuzzy here.
Yep.
So it's still fading. And then this whole chain, and then this, which was right here.
And that was with one treatment.
One treatment. Definitely. So that's an excellent result with one treatment.
The doctor recommends another follow-up at Vanishing Veins in a few months, just in case anything new shows up. But for now, I feel I've passed the test.
Are you happy
I'm ecstatic.
with the results?
Yeah, I mean, this is, I used to look in the mirror and go, oh God, what is with that? You know, and I put my bathing suit on, and now I got nothing there.
When I go and I examine a patient's legs when they come back for follow-up, and if I can't, forget the picture, if I look at your leg and I can't tell where the veins were, then that's about as perfect as you get.
And you talk about bedside manner. She's like my new best friend. I love that woman.
I just love that it really worked for you on one try. And
One
so
try.
sometimes that can happen. You can't expect that.
The worse your veins are, the more likely you are to run into more treatments.
And it was so important that you did what you're supposed to do and wear the support hose every day.
And everybody laughed at me, and I was like, I'm not taking my support hose off because I only wanted to go through this once. Now, again, as we said in the story, we're going to go back in September. I'm going to just do a little follow-up. There's one little area that I want taken care of, and that's it.
And this is for life.
For life. Dr. Greenwald is a nationally recognized vascular surgeon who has been in practice since 1985, and she's a treasure right here in Bloomfield, so check her out.